The Milestones series on recovery, tracking the milestones of the recovery world, chronicling the industry leaders, revealing their insights. Milestones, saving families, saving lives. Dr. Amiri, you're the consulting clinical psychiatrist to Milestones Ranch Malibu. What is your unique gift?
Well, I think I'm definitely more of a therapist trapped in a psychiatrist's body.
What does that mean?
Well, that means that my goal is to take as much time as I need, and obviously what my patient needs, to get to understand them and treat them appropriately. So that doesn't mean just prescribing medications as soon as I hear the word depression or anxiety. It's to really understand as much as I can the root of the problem, rather than mask the symptoms with Band-Aids that may or may not work.
So Dr. Amiri, it's ironic that, say, a client is coming to Milestones Ranch Malibu and their actual problem is that they're addicted to prescription drugs, and yet they're coming to you, a psychiatrist. So how do you deal with that?
Well, the whole point is to help them understand that, yes, they're addicted to prescription drugs, but also I have to see who the true person is underneath the prescription drug. So that means even a period of time that they spend here at Milestones independent of being on any medications. Obviously, if someone is suicidal, homicidal, or they're spending all their time in bed and not working the program here, then I have to prescribe in that situation.
And that's usually one of the concerns of most patients about seeing a psychiatrist is, oh no, within the first 15 minutes they're going to give me medication. Now you said you seek to see the whole person.
Yes.
And you also work in dual diagnosis. What is that?
Dual diagnosis means basically, it's very simple, that substance use disorders can coexist with primary psychiatric disorders. So again, in order to understand the person fully, any clinician, psychiatrist, psychotherapist, has to take the time to understand their patients. And that means you can't just meet with a person for the first time for 15 minutes and prescribe a medication, because the history that we take is actually our way of examining the patient, since we don't use a lot of imaging. So it's really the time that we give to our patients and really utilizing the compassion and the reflective empathy that the patient needs in order to trust us, so we can be more effective in helping them.
And to achieve that effectiveness, you talked about being a therapist trapped in a psychiatrist's body. So are you trying to get people out of those meds?
It depends. Sometimes I have to prescribe. Sometimes if the biological factor that's contributing to the problem, let's say there's a family history of depression, and the person has responded very well to the medication, that's telling me that the biological factors contributing significantly to the involvement of what I'm seeing as depression, or what the patient is reporting as depression, and the signs that I'm seeing. So that's where medication can have a very effective role. Just like an analogy that I always use with patients is the right diet for that athlete to train. So that's how I look at medications.
Dr. Amiri, you talked about creating the unique, specific diet for the athlete. You talked about seeing the person as a whole. So how do we distinguish the biology, the psychology, and the behavior of each person?
It's not about separating or distinguishing. It's about understanding that the biological factors, psychological factors, and social factors all contribute to the involvement of a psychiatric disorder and or a substance use disorder. So it's going to be different for different people. Different percentages of the biology, meaning pertaining to family history or medical conditions that could contribute to the involvement of certain psychiatric symptoms or disorders, as well as the psychological factors which pertain to basically the traumas, the losses, the abuse, the abandonment, the even overprotection and overgratification of that individual as they were growing up in their family of origin. And then the social factors that are basically the factors that at the end of the day, the person, that individual who is seeking treatment can eventually be most instrumental in alleviating the negative factors, such as getting rid of friends that are contributing to their downfall in life, or a bad relationship, that all gel together along with the psychological and biological factors and causing the problem that we see.
So you're really talking about seeing the whole person from every angle, every perspective, to the extent of saying, these are toxic friends, this situation isn't good for you, we need to adjust your medication.
Yes, and it has to be personalized because, as I always say, there's no formula to this type of, there's no one blueprint that we can prescribe to all our patients. We have to go to where the patient is at and really personalize treatment. And in order to personalize treatment, we have to understand the person fully. And that means to not only understand the medical/biological problem that we're seeing, but also the psychology and then the social factors. So it's intricate and challenging process, but it's very gratifying when we can help our patients and empower them to make the changes necessary to live a happy, healthy, fruitful life independent of using.
You're referring to people as being unique, and it's interesting that often parents may not be able to fully understand their children and vice versa. Are we truly that different? Are we truly such unique individuals?
Of course, because everyone's upbringing is different. The people are raised in different cultures, different families, different approaches that were taken by their parents to raise them. So that makes them quite unique, in that if they're raised in a particular way that they were told, let's say, for example, they're not good enough, they're going to think that for the rest of their lives unless they have the opportunity to seek treatment.
What do you think is the greatest progress and advance that's happening within the industry?
I think what's happening more within the industry and with my colleagues is their understanding that they need to take a more proactive role in the care of their patients, meaning that after 30 days, 60 days, or 90 days here at Milestones, the treatment doesn't stop.
So it's not just about, oh, your time's finished,
Yeah.
whether that's a month, 2 months, 3 months, or 2 hours. It's about understanding that the patient, the client, still needs support and continued care.
I'm happy to see that that's happening more often, and I'm happy to see that more empirically proven approaches are being taken. Clinicians and colleagues are learning about these modalities, such as motivational interviewing and cognitive behavioral therapy and dialectical behavioral therapy, which is basically an offshoot of CBT, cognitive behavioral therapy, and using these therapeutic modalities in helping their patients.
So as a therapist trapped in a psychiatrist's body, what is the most important gift or quality that you would bring to your patients?
I think the time that I spend with my patients, and also helping them understand that I'm really here because I care.
So it's not just time, it's what you do in that time. And you're saying, I'm giving them plenty of time and then giving them lots of care.
Lots of care, that I'm not just a doctor here on Mondays or certain Thursdays when I show up to see patients. I'm their doctor 24/7.
And you're actually honoring it.
Yeah, I have to. I have to keep it real and practice what I preach.
And for what are you most grateful?
I'm grateful for my health, my family's health, and also this opportunity to be here amongst great clinicians and a team here at Milestones who really care about patients and really show that from the get-go.
You talked about Milestones Ranch Malibu as being dual diagnosis, seeing the person as an individual and treating the whole person. What else would you say is unique and special about Milestones Ranch Malibu?
Again, it goes back to not just signing off once the person is discharged.
So what also makes Milestones Ranch Malibu truly unique is the sincere care, compassion, and dedication and devotion.
Absolutely. Absolutely.
So being at the very top, as a consulting clinical psychiatrist to Milestones Ranch Malibu, it's easy that when you're always giving to everyone, not many people come back to you and say, thank you very much for the great, wonderful work that you've done and the devotion, dedication and commitment you've given to everyone at Milestones Ranch Malibu. And we say thank you.
It's my pleasure and duty. Thank you.